Hi, everyone. Thank you for joining today's webinar. I'm Nicole Clement, a program specialist with the TASC team here at the National Rural Health Resource Center. I'm super excited for today's topic, fostering a culture of resilient rural EMS. And while I go ahead and introduce our speakers, Patricia, would you please launch the pre-polling questions? If you all could take just a minute to answer these couple of polling questions, that would be great. And with that, here's our speakers. So John Becknell is a community and organizational psychologist and an accomplished facilitator, interviewer, teacher, and researcher. He has been involved in emergency services and healthcare for 35 years and has worked as a paramedic, educator, manager, systems developer, and consultant. John is the founding publisher of Best Practices in Emergency Services and the former editor-in-chief of the Journal of Emergency Medical Services, or GEMS. He serves on numerous national projects and provided the conceptual design for the National EMS Workforce Agenda for the Future. John has been involved in emergency medical system development in North America, the Middle East, and Central America, and he is the author of 2 books and has published articles in numerous journals and trade magazines on emergency services administration, management, and workforce. John has a passion for finding and identifying best practices, as well as understanding the sociological relationship between EMS and the communities they serve. Next, Michael Washington is a retired firefighter and Master Sergeant, U.S. Marine Corps, also retired. He is a mental health therapist and an international speaker and teacher on first responder mental health. He is a veteran career Seattle Fire Department firefighter and EMT and a 4-combat tour Marine. He is a consummate professional with a vast real-world experience, education, and training in first responder well-being, disaster response, and CISM, counterintelligence, counterterrorism, and security, the United States Marine Corps, firefighting, and EMS. Mike has operated in the most austere and dangerous environments with tours of duty as a combat infantryman and intelligence operator and a tour at the National Counterterrorism Center. Mike has deployed internationally and domestically as a disaster response volunteer with Team Rubicon, serving as incident commander, division supervisor. Mike is known for his compelling story and openness about his own struggle with stress and depression following his Marine Sergeant son's combat death in Afghanistan. And then also after those two, we are going to have Nicole Threadgold of the North Dakota Flex program and John Noakes of the Washington Flex program, just to talk a little bit about the work that they're doing with their 2 state Flex programs. So with that, John, I'm going to turn it over to you.
Great, thank you, Nicole. Please let me know if you have any trouble with sound. Well, it's really great to be here with you, and I know Mike and I are excited about this topic and have a passion for helping folks develop cultures where first responders not only are resilient, but actually really thrive in the work. Both of us are excited about this work. It's been a passion of ours, and we're interested in helping organizations, and especially rural organizations, as the topic today, develop resources and develop internal cultures that really foster well-being. So our interest in this topic is this, that being a first responder, EMT, paramedic, firefighter, law enforcement will inherently bring adversity. There's just the nature of the job, and what we're really interested in is how do we as an organization begin to help our people do well during this. And what we learn is that when people work in environments where taking care of themselves is prioritized, when the adversity comes, they do so much better. So Mike, this is something that you know a lot about, and just talk for a few minutes about why resilience is such an important issue today, especially in departments where workforce are huge issues, finding and keeping people, and talk a little bit about what your experience and your learning as you work with multiple departments these days. You're muted. Mike, you're muted.
Sorry about that. Thanks for having me on, everybody. As we talk about this topic, this new flavor of the month, if you will, in the fire service, about resiliency and preparing for that worst day, it's really across the board. Whether you're FDNY or Seattle, or whether you're a smaller department, rural volunteer department, because you will see those worst things. Now, what we can do and what we have to look at now is building this armor in front of us to handle that adversity. In the past, I know from my example, in the era that I grew up in, just as a male, just as a firefighter, as a Marine, you didn't talk about this stuff. You just went through it, you rubbed dirt on it, and off you go. And we know now that that's bad for you. Coping with alcohol, coping with gallows humor, not coping at all, that will eventually get to you. And if it doesn't affect you directly on your job, it's going to affect your health. It's going to affect your retirement or your ability to retire. So it's vitally important that we address this now, because we are going through the same issues in our larger cities about retention and recruiting new people into our jobs in law enforcement and in the fire service, that we just aren't getting people, including in the fire service. And that's unheard of. That is unheard of, to have to go through these struggles. And it's because people are looking at our jobs and going, well, that just does not appeal to me. We're having firefighters who have been on the job maybe 3 years, 4 years, who are deciding, you know what, this isn't for me. That didn't happen before. Once you got your job in the fire department, boy, you clung to that until they had to just pull you away from it at 30-year mark. But we're not seeing that now. And that's because of the changing nature of what we see in our jobs. So what we have to do now is just really concentrate on armoring our members. And it doesn't matter what size the department is, because it's all emergency response. We all wear breathing apparatus when we go into a fire. We all have changed from having our turnout bunking coats in our sleeping quarters. We don't do that anymore, right? Rural or large departments. So we have to bring all these new ideas across the board in the fire service and in law enforcement as well.
And what we're seeing, and I love your comments on this, what we're seeing is that there's a connection between one's ability to handle adversity, the difficult call, the sustained busyness, whatever it might be. One's ability to handle that adversity is really directly connected with how well they take care of themselves prior to the event. And there's been so much focus on CISM and after the big event stuff, but what we're really realizing today, that this is something that has to be front loaded. So Mike, when we talk about resilience, what are we talking about? When we talk about doing this, what is this?
Well, the resilience is the ability to bounce back after that bad call, or to keep coming back on those multiple small T traumas that we see as first responders. And I like to use the analogy of, instead of being the oak tree that's strong and tough and everything, but boy, when an oak tree shatters, it shatters into a million pieces and can never be put back together again. Instead, let's look at ourselves as that palm tree that can go through that hurricane and whip like this. And then when that storm's over, there it is, standing back on the beach like everything is good. So that's a multifaceted strategy that we have to look at. And that's part of living well. That's part of our diet. That's part of our mental outlook. That's part of our social relationships. Building all of these things and putting them in place, that helps us be resilient. It doesn't happen on its own. It doesn't happen in a vacuum. If the rest of your life outside the fire station or the police precinct is not going well, you are that much more susceptible to not handling that big T when it comes and it hits you. And that was me. That was me. Everything else in my life over, decades and decades of ignoring large traumas, small traumas, and just rubbing dirt on it and walking it off almost killed me, literally. So if we build up and make our lives better in the front end, when we see those bad things, which we will, because this is what we signed up to do, right? When we see those things, we are going to be able to weather it in a stronger manner. And if we need that help, we have the help there. Because like John said, we've gotten really good at trying to catch on the aftermath with defusings, debriefings, sending people to treatment, all these things. Okay, great. And now let's go to the front side and put armor up. And that way we reduce what we have to do on this back end, because no matter how well we do back here with all these other try to catch models, we lose people.
So your own experience was the rubbing the dirt on the wound and just stiff upper lip, thrusting your chest forward and continuing to move forward, eventually caught up with you. Just talk for just a couple of minutes, Mike, about your own journey back, and now looking in retrospect, what would have helped on the front end.
Sure. The other component of this is understanding where we came from. What is our story before we showed up to become that first responder or being in the military? Who are you? What happened to you before you got on those yellow footprints, as they call it, in boot camp or at your recruit academies? And for me and a lot of people my age, there was poverty, there was violence, there was alcoholism, molestation, and I had all of those in my life before I showed up to be anything else in my life. And there's an old saying that says, you don't go looking for these careers, but these careers come looking for you, where you might be that person who says, this thing happened to me, and I want to go and make sure that doesn't happen to anybody else. So you put that weight on your shoulders. So when I go into the Marine Corps and I go through my combat tours in the Marine Corps, and again, there's nothing's taught to you about, seeking help and, it's okay to not be okay. And this is what these things mean. It's where you just look at your examples of your Clint Eastwood, Gunny Highway role models who you want to be like. And so I'm going to be like that guy. Okay, yeah, he's divorced and his kids won't talk to him, but I still want to be like that guy because that guy's tough. And same thing in the fire service. So you start collecting these large traumas, these small traumas in the fire service, but you don't talk about it, you don't deal with it. And so subsequently or you do deal with it, but for me, it was with alcohol. And then subsequently, when you have that disaster in your personal life, for me, when my son was killed in Afghanistan, that's when finally the dam breaks. And I am without ways to cope. So I go back to what I was taught growing up, what I observed, what I learned in the nurture component of my life, and that's alcohol and violence, fighting and drinking. That was an acceptable way for a man to express his emotions of what was going on in his life. And so subsequently, even that, doesn't work. And I found myself standing on the edge of a bridge, ready to go over, until I finally decided to get help and start to unpack some of these things for me that started as a child, then the military, then the fire service. It was 50 years of stuff for me. Now, if we do this right, with the people coming into the recruit academies today, and give them this education at the beginning and help them build these strong barriers and protective factors at the beginning, then they don't even get anywhere close to where I am. And they're more apt to be resilient, be that palm tree that yeah, that was a bad call. It was horrible. There's nothing in the world that says that call wasn't bad. Boom. But I know how to deal with this because I have these protective factors that I can talk to. I have a social circle. I'm spiritual. I have all these things in my life. Oh, and if that still isn't all that I need, wow, well, I've got a peer support program and I've got therapists that I can go to help me and put me back to where I want to be.
So not only did you bounce back, but you went on to become a therapist and now are working with a number of first responder agencies, police departments, fire departments, EMS agencies, some of them in cities, some of them in rural areas. And so one of the things we noticed, Mike, is that, and I think this is such a important thing for the Flex program people to really understand is that the issue for many first responders is not a knowledge issue, it's a culture issue. So we can sit down and ask a fairly new recruit, if you're going to be high risk, high stress, high responsibility occupation, 24/7, going on difficult calls, what should you do to take care of yourself? Most of them will tell us. Most of them know about the importance of sleep and taking care of their body and talking to people if they have a difficult or something that triggers them. They have some awareness of this, but the problem is really what we call the well-being paradox, the disconnect between what they know and what they do. So talk a little bit about how culture in organizations really rewards sort of the armored up Clint Eastwood tough guy kind of thing, and doesn't reward or normalize this kind of talking.
Well, and you know that thankfully, in my experience, that ship is changing course now. And even so at the academies where we have to, that's where we begin that culture change. You know, people my age, you know, I'll be 60 here in August. And so those people who are still on the job at 55, 60 years old, however old they are in the rural departments and volunteer departments, I'm not going to say they can't change because I did, but they're more apt to be set in their ways. So we have to capture first and foremost, I think, the brand new recruit showing up and saying, this is what we're doing. And the mid-level person as well. Those are the ones who really control the culture, the official and unofficial leaders. And they're the ones who kind of, make things happen in their respective departments. They're the ones who are going to write that curriculum for the recruit school and put the stamp of approval officially and unofficially on any kind of peer support or wellness program that comes out. And those are the things that really change the paradigm changes in your organization. So really capturing the kids as they walk through the door, bright-eyed and bushy-tailed, and says, hey, here's everything about the job, the good, the bad, and in between. And here's a new topic that we're going to talk about. And that can be done. And it might take a while, but it depends on how we look at it. When I came in the fire service, the guy who was walking out the door when I was walking in, he told me about not wearing a breathing apparatus into a fire. He talked about how grudgingly they put a breathing apparatus on, but then wouldn't put the mask on. And then they were forced to put the mask on, but they keep the air on until it was sucking into their face. Then they took it off as they were leaving the fire. And just all these little incremental changes until finally the recruits who come out into the fire service now, they're walking out of the building before their bell rings because they are so in tuned as to look at their air and know how much air they have. That took a long time to change that way. And I know there's some departments that still don't do that, but it's anywhere on the West Coast here, you'll never see somebody whose mask is sticking to their face in a fire because that paradigm change has happened. We don't put turnouts next to our bed. They don't come into our living quarters anymore. That was a big shift, understanding that process. So that can happen, but it has to happen from the beginning.
And it has to happen inside out. So using this metaphor of the breathing apparatus or the bunker gear, what in rural agencies, what's so important to change is this making it normalized to actually even begin to talk about this. Because what the previous norm was not to talk about it, not to preference self-care, but in fact to really reward pick up as many shifts as you can, go on as many calls as you can, dust yourself off, come back again. And instead, we're looking at something else. So when we talk about resilience, what we're often talking about is a combination of some things. It's and you really mentioned this, Mike, it's first creating expectations. This is going to be a tough and difficult job that is going to stir up whatever baggage you came with. And the expectations are that you are going to have adversity in this. The second thing that we really talk about is this whole idea of self-care. If you don't find balance, if you don't understand your feelings, if you don't have some level of emotional intelligence, if you don't have something that we call refuge, if you don't have a place to disconnect from this role and its sort of archetypal nature, you'll struggle. And if you don't have a way and established patterns of recharging. So self-care, so we talked about expectations, good self-care. We talk about perspective. Perspective we're learning is really vitally important. And it's really difficult for cops, firefighters, and medics to have good perspective right now because of all of the social, political bickering and everything that's going on. But finding a perspective and cultivating that is often done through this next area, which is community. We find that the people who have a supportive community do the absolute best. And then the final thing that people need is resources. Resources are all of those things that when I need special help, I can get it, but also when I need to be a resource to colleagues or a neighboring department, I can be that. So expectations, good self-care, perspective, community, and resources are often what we're talking about developing within the department and what the culture has to normalize. Want to add anything to that, Mike?
Yeah, and gosh, it's really fascinating. It's like, and it's exciting to be involved at this paradigm change within the fire service, and even just in the departments I work with, a large one like Seattle and a smaller one like Lacey, where I'm at right now, that goes out on these rural calls, because it's all applicable to wherever we go. And John, when we were in North Dakota last year, you said it really well to the groups out there who said, but we have to do this and we have to do that. And you said, there's only so much you can do. And you lay it on the administration, says, okay, look, we're tapped out. We can't go any further. Our people have gone as far as they can go. And they will make that change or they won't. And you use that great analogy or example of Georgia, the state of Georgia no longer having the same volunteer EMS outfits like they used to, because they had to pay people. You pay people to come on and do this kind of work, where they were doing it for free for the longest time. And boy, the government will take free all day long. But at some point, you say, we can't do it anymore. We need to attract people. And we're seeing that in the fire service and law enforcement across the board right now. We're going to have to pay people more to do these jobs. That's just how it's going to be. But it's exciting because we get to, what we're talking about here is not rocket science, but it's great to see that light come on when you tell people, like, okay, it's great to have, these to focus on the fun things that you like to do off shift, to take off the uniform and to do that new thing. So my wife and I, for example, we're ballroom dancers. And so that's our fun thing to do. So it's not just fun for my wife and I to do together and learn how to do these great dances. I have a whole dance family that has nothing to do with fire, has nothing to do with anything but dance and the love of dancing. And that's a great feeling to have. That's a great refuge to go to when the job got to me or it was just weighing heavy. Man, I had a cha-cha routine that my wife and I we're going to work on to get better at. And that's a great escape. And it just takes the job away for a moment.
So you brought up two important things, and I hope the flex coordinators can get this. And the first thing is that when you do this job in rural areas, there is a declining number of people who are willing to do it, and fewer people are carrying heavier and heavier loads. And one of the things that is very difficult to introduce to a rural department is that you can't be on 24/7. Many of these volunteer services are all-call departments where they carry a level of stress all of the time. And what we understand is that rural is rural and change is slow. And what we mean by that is introducing ideas in these departments that have to do with self-care and well-being take time. And any programming that you're going to develop in rural areas has to have a period of introduction and acceptance. Simply going out and saying, we have a stress workshop for you, or we have a difficult call workshop for you, is not going to do it. In fact, what we're finding is that emphasizing the negative, in other words, focusing on what we call the big five, which is stress, PTSD, substance abuse, depression, and the suicide, are sure ways to shut people down. And instead, we're raising a different question in rural departments, which is to say, how do you do a difficult thing, which is to be one of the few people left on the roster providing a service that you feel valuable to your community, but maybe others aren't willing to pay for? How do you continue to do that and be a good human being and take good care of yourself? And we're beginning to just introduce the question of, can you continue to operate as you're operating and still be a good dad, a good mom, a good friend, a good parent, a good lover, all of the things that are necessary. And we're beginning to just ask people, how do you do this and find balance? It's one of the simplest questions to just sit down with a bunch of rural first responders and say, does it feel balanced? And a question that we ask and introduce this with is we ask the question of, does it feel that what you're giving is balanced with what you're getting? And what we want to do then in the introduction of this topic is just to get people to begin to have a discussion, to be a little bit more reflective, so that I did it, I'm the tough guy, I can dust myself off and do it again, is no longer the model, but instead the model of, how do you do this, find the intrinsic rewards, and really, really enjoy it long term? And is it possible? And we think in some environments, as Mike mentioned, it's going to be very difficult. And the only way forward is to help the people internally begin to look at how they're doing it. And let me just say this, culture is a way of talking about how we are together. How are we as a group? And the change comes when the group starts to address this. The paradox, that paradox I talked about, the difference between what people know and what they do, the way to bridge that paradox is to get people working with each other. The reason people start wearing the air masks in the fire department and don't put their bunker gear next to their beds is because it became normalized amongst the group. And it's really group behavior that changes. And that's why the culture is so important. So Mike, I'm just going to mention some of the things that we try to emphasize when we go into rural departments. What can a rural service do? One of the first things we ask them to do is start having a discussion about whether or not well-being and resilience is actually a priority for your organization. Because if it's not, this is really what happens. If it's not, then what happens is we actually find the opposite effect, that any programming creates negative will toward well-being. So the first discussion that an organization simply has to have is, what do we believe about this? Do we believe it's a bunch of new age bullshit that we don't need to pay attention to? Or do we really believe that this is important for our people? That's the first place that we start. The second thing we want to do is to start normalizing the conversation. And this is beyond just somebody checking in and going, hey, Mike, how you doing? It's beyond that. It's beginning to start saying, hey, how is this work impacting your life? How are you doing in your personal life? And we often take that question a little bit further, which is to say, what would your family say? Would your family say that being a volunteer EMT and paramedic is making you a better human being, or actually making you more crabby, less accessible, less connected? How's that showing up? So starting a conversation, that's all we want to do in the second thing. The third thing that we really are are trying to do is to get people to start making this a regular discussion. If you're going to have training once a month, if you're going to have training twice a month, whenever you're having training, start with 15 minutes at the beginning just to begin to talk about how we're doing and taking care of ourselves. By simply introducing this at the very beginning of a training, what happens is people start to see it as normal. And remember, culture change takes time. And so the programming is to help people find small and little things to do at the very beginning. The next thing we try to do is bring in user-friendly resources from the outside. It's one of the reasons I wanted to bring Mike along today. Mike walks into a room and he's a user-friendly resource. People know that he's he's been there, he's done it. He's not only been in combat, but he's been on those 24-hour shifts. He's been on those calls at 3 o'clock in the morning. He's worked the SIDS death. He's done all of these kinds of things. And the user-friendly resources are essential. I don't know, and Mike, just speak to this. Both military folks and first responder folks aren't very open to talking to folks that haven't walked in their shoes.
This is true, and what I caution though for people is that, you know, my mentors as a therapist, as a trauma therapist, none of them wore uniforms before they became therapists. They were just really good therapists, and they were able to listen and absorb and learn about the cultures of law enforcement, the military, and the fire service. So it's not necessary. I think if you're a good listener and that good person, then you can get in and do this. My background buys me a little bit more time on my audition when I come into that firehouse. So for example, where I work right now, I've been here for about 8 months, and it was an audition when I walked into the firehouse. They're like, okay, you know, I might come from Seattle, but that's not here. And so they were going to listen to me for a little bit longer than they would somebody who wasn't, but I had to produce, right? I had to produce. One of the things that you talked about, John, as well, was, you know, when we talk about wellness and these other things, what's that going to look like? And, you know, it wasn't too long ago that words like yoga and meditation sounded like, you know, almost satanic, you know, Eastern mysticism kind of phrases in the fire service and in the military. Now we can talk about mindfulness and meditation and yoga, and those are almost trade terms now. Okay, so there's a great example of that paradigm shift that we had, because we talk about it in the drill schools and we talk about it in the academies, and it's not just a one and done. It's one of those things that is normalized in the conversation and in the training, like John says. In the fire service, we practice for confined space in the culvert, you know, the baby Jessica calls. You go and you do that a couple times a year. You're going to go put on a harness and go in there and pull the dummy out. 32 years, I never came close to a call like that. Not even once. I was ready to do it, but for the mental health training that we needed for most of my career, we didn't get any of that. Well, now we're starting to do that more. And so that's kind of the way we should look at it. Okay, what kind of training are we getting? Okay, we're going to take a car apart, we're going to do the culvert, basic house fire stuff, mental health stuff, like it's cool, like it's just like an everyday thing. And again, I go back to starting and teaching our children, being the young people in our fire service and law enforcement from the very beginning at the academies, and getting them in that direction. And it can change that course. And again, using those terms like yoga and meditation and mindfulness are no longer like, oh, what's that? I don't know what that, I'm scared of that. Not that anymore.
And I would say, and likely in many of our rural departments, those words probably are. Mindfulness, meditation, yoga would be still, but simply as we begin to talk about this, what we find is a softening, and what people realize is that they're in good company in terms of starting to take care of themselves. And I just wanted to mention this, Mike. One of the things I did recently with a small organization that I was working with was we just had a discussion about do you know what you're feeling when you're driving home? And we wound up having this discussion about practices of what do we do in the car when you're going home from a shift or you're going home from a bad call. What do you do in the car? Crank up the tunes, open the window, light a cigarette. What do you do? What is your practice? And we had no judgments. But what was really interesting was people opened up. And there was a lot of laughter and there was a lot of talk about it, but there was just this conversation that was the beginning of a normalization of talking about feelings. If you and I walk into a department and say, hey guys, gather around, let's talk about feelings, nothing's going to happen other than some pretty ribald jokes flying out. But if we sit down and begin to find new ways to open up, and the reason I'm sharing this is that I want to encourage people running these programming where you're providing money for this programming to happen. Go for the stuff that will be accepted and be door openers. Because once the door is open, what we find, and this is the work that I hope we'll talk about in a minute that's going on in North Dakota, is there is just a beginning of a door opening. And somehow you got to get your foot in the door when it comes to talking about this. Well, the last things too, I'll just mention, Mike, is it's important for organizations to identify resources that their people can use. And the last thing I'm going to mention is getting real clarity about what you're going to do after the big events, and making sure that it matches with what the people's expectations are and what they're willing to participate in. CISM works well in some places, but it's been sold badly in other places and doesn't work well. And that also is another good place to start, is just to start to have a discussion with people of saying what works with you and what doesn't work, and beginning to start making them participants in the development of well-being programming and creating this culture of well-being.
No,
So,
you're exactly right, John. And you know, so there's not one fix. There's not one, oh, we're just going to do this and everything's good. Because we kind of did that for a number of years with CISM. And it was just like, okay, we have CISM, we're good.
Good.
Without really looking at the whole firefighter, you know, the whole police officer, the whole EMS person. So
Nicole, we can want to bring in some other people to talk, so I'll just turn it back over to you to lead the discussion from here.
Okay, sounds good. Thank you. If anybody has questions for Michael or John, go ahead and drop them in the chat for right now so that we make sure that we get to them, because I want to give you guys an opportunity to ask questions if you have them. For now, Nicole from North Dakota is going to talk a little bit about the work that they are doing related to this with the North Dakota Flex program.
Great, thank you. So today we're going to be joined by members of the North Dakota Flex program and then also the North Dakota EMSA program, who really work collaboratively to bring together the work that we're going to talk to you about. So you'll see on camera Kurt Homrest, who is the past president of the North Dakota EMSA, and then also Jody Ward, who was our North Dakota Flex program director. And so the resiliency work that we're discussing, yes, it's funded through the Flex program, and it's really a collaborative effort led by Kurt and his team at the EMSA Association. And then, so Kurt's going to walk everyone through the work so far in North Dakota, and then Jody will share how the Flex program participates and monitors the work. So I'm going to go ahead and share my screen.
So as Nicole mentioned, I've been with the association for about 20 years in a number of facets, and I'm very appreciative to be here with you today to talk about what we're doing in North Dakota. I've been helping administer some of the flex activities for about the last 10 years, and on the mental health subcommittee that we have for the association. And this work is, like many of you, probably near and dear, because workforce challenges is a big thing that we all are facing, and we don't want to see providers that are lost to either the suicide rates that have been increasing over the last few years, as well as just the burnout and just people leaving the field in general. So go ahead and next slide, please. And so really, how did we get here? And it really started back in July of 17 when we started offering mental health first aid courses. But that was really more dealing with how to react to a patient that's having a mental health crisis. About a year later, we had a provider in the central part of the state, one of those black clouds hanging over their service, and they had a number of bad calls, but one trigger call in which that paramedic had to respond to a call in which it was her son's best friend. So basically almost like her adopted son. And she nearly walked away from EMS. In fact, she took a long time off the schedule and really considered just simply walking away. And that's where probably a lot of people are when that situation happens. And she decided to be more, try to be proactive, and looked at what can we do to, there's nothing really out there, at least at that time anyway, to look at how can my service deal with this if and when, it's a matter of when it happens again, when that black cloud hangs over my service. And so she actually developed a course, and we did offer a number of those resiliency classes throughout the state. And that really, because as a subcommittee was born out of this, she went to the association and said, what can I do? I'm only one person, but what can we do together? And, when we sat down and looked at mental health in general, there's, really two major influences on behavior. And one is societal expectations, what we expect as a society, and that can come crashing down on us. And there isn't much that we can do. We can't change a lot of the political discourse and a lot of the things that are happening within a national level. The second being just our coping mechanisms. How can we handle what is thrown at us? And that is something that we said as an association, we need to take on. We need to be proactive rather than what the Cism or CISD deals with, and that is the reactive phase. And so we really thought, based on what we could do was that coping part of it. Go ahead, next slide, please. And so what we really want to do is arm agencies who then can take that down within their service. Service members aren't going to be receptive to someone outside of their service typically coming in and saying, you guys need to be more well-being and more resilient within your service. They need to look within their service themselves to make those changes. And so really what we want to do is just make well-being a priority. We're not shoving any of this down their throat. We're not requiring them to necessarily be a state mandate where training is required or anything like that. We just want to make sure that they're thinking about this in the back of their head as they're going to these calls and what call is going to be their next bad call. Go ahead on the next slide. So we've really kind of taken a multifaceted approach in that we are looking at what can we do as a state, but what can we do regionally, and then taking that down to the service and to the individual. Go ahead and go to the next slide, please. And so some of the self-care, this has been, John has talked a lot about this in the trainings that he's offered to us in North Dakota, but basically grab a beer, and the beer being, how are you doing within your body? How do you feel? Your emotions, are your emotions in check? Are you really feeling like you're here? Are you engaged? And then your relationships, do you feel like you're closed off? Are you kind of shutting down, not wanting to interact? And really that comes down to a lot of these service members who kind of start to kind of go off in their corner, and you know these people, and you know that it's happening. How can we get to those people before they decide to say, I'm going to turn this pager in because, you know, this isn't what I bargained for. I don't want to do that. Go ahead to the next slide, please, Nicole. And so our timeline, as I talked about, we really started back in 2018 to identify the need that's out there, and really based on that one bad call. But it was brewing prior to then in terms of what some of the work that we were doing with mental health. And then obviously we offered some courses in 19, and then the pandemic hit, and we obviously slowed a bit in some of the work that we were doing, but we still offered some of the trainings online. We still kept meeting as a committee, but it did slow the work that we were doing a little bit. Nicole, go ahead on the next slide, please. And so where we started after the course was developed, there you can see a picture there, building a culture of wellness and resiliency. It was about an hour to an hour and a half long session that we did, and we did 56 trainings throughout the state, and we did it in about a 2.5 month time frame before our biennium ended in North Dakota. And so we offered these courses, and it really kind of started getting services talking about the importance, and it really kind of started festering some ideas that we had. Can we take this further just beyond just a PowerPoint and a presentation? What else can we do to help build resiliency? Go ahead with the next slide. So in our 21 work plan, we looked at how else can we work into our various flex activities. We offer anything from management training to leadership training to, like I said prior, we've been doing the mental health first aid for the last 5 years prior to this. We started offering PTEP courses, and what PTEP is a course 8-hour session that's offered through the National Association of EMTs. And it gets into how can we decrease psychological stress, how can we understand the responses that we have to stress, teaching the escape principles. So essentially, we've offered those courses in addition to the mental health first aid. We kind of stepped away from mental health first aid for a bit, as we've been offering that for quite some time. And sometimes we just want to mix things up a little bit and do something different. Go ahead, Nicole. So where we're at the last year here, as John and Mike mentioned, they had the pleasure of coming to Fargo back in May, and we had 27 attendees go to their 2-day workshop. Wonderful workshop. I don't think anybody walked away from that not just feeling empowered and energized to come back to their service and to really challenge their service members to think about how their well-being affects their future of the ambulance services. And so, but we wanted to take that a bit further, because training 27 people is still just 27 people out of 7,000 providers in the state of North Dakota. We wanted to take that further. So in July, we did our mental health summit. This was something that had been planned for about 9 months prior to that. And we looked at kind of the whole approach from how do you deal with a patient that's in a mental health crisis, to how do we recognize team members who need help, to then looking at yourself and thinking about what you can do to help yourself. And we had Chris Culkins, the Center for Suicidology in Minneapolis. He presented for us and did a great job. And so we offered this summit once a year that focuses just on the well-being and mental health of our providers. And lastly, John was just here in North Dakota last month and started to get the seeds planted for resiliency in the work that our mental health subcommittee is doing. So he talked about, essentially the introduction to peer support, the introduction to the well-being support team concept, and kind of the work that is going to be coming in the next 1.5 to 2 years. Go ahead on the next slide. So the work that we talked about with John and with Michael is developing videos. just short 15-minute videos to how do we armor up for our calls, but then how do we armor back down? How do we take our hat off at the door and say we're not being a provider when we're home? Finding balance. How do we, not let stress control us? How do we live well? So we're making these 15-minute videos shortly through a number of our committee members, as well as outside our state, just working between John and the committee. We're looking at developing a handbook to arm service leaders, service agencies to have something that hopefully doesn't collect dust on their shelf, but they essentially can refer back to that handbook for a variety of resources. One thing that we have identified is that there's such a shortage of obvious mental health providers, but there's also those who just don't understand EMS. We've had providers get access to different resources, and they go there and they talk to a professional, and that professional says, wow, I don't know EMS at all. I don't know, I wasn't prepared to hear about the things that you see and hear. And so what we want to try to do is reach back out to the mental health providers and arm them with information, as well as try to, we don't not necessarily cross-training them in EMS, but at least make them familiar with just kind of the horrific types of events that we often have to deal with. Go ahead on the next slide, please. What we're also looking to do is kind of infiltrate EMT courses. Initially, those EMT students that come out for the first class, trying to get them the training before they become a full-fledged EMT. Also doing some ongoing training. We're having our mental health subcommittee members go within service agencies and get this information to them. And in July, John is coming back to North Dakota again and doing a day one, doing a training that's going to train the trainer, in which we're going to have our subcommittee there and basically arm us up with the information that we can go out and educate services on. And then day two, it's going to be how can we utilize the principles that we learned from day one on the audience that we have before us. And you can see the work plan monitoring. There's a lot of activities that we're doing, both the ongoing as well as kind of in our 2-year plan that we're working with John and Mike a bit. But essentially we have the administrative support through our office administrator here. We are, it's a volunteer position, but a project manager to keep us on task, or at least our subcommittee anyway. We do meet monthly and we meet quarterly with Jody and her team at UND to kind of keep us on track and what we're doing. And we also have been doing surveys and evaluations to see what services find useful and what they obviously want and what they feel is beneficial to them. Go ahead with the next slide.
Can I just jump in as a flex program on this work plan? Yeah. So just as a flex program, and other flex programs too, we do meet quarterly with Kurt and his group. So just do a quarterly work plan. And so all these activities are written into our line items for our flex work plan. And so we just do a quarterly check-in on the activities, where they at, how is it going? Quarterly we do that. Then we would work with them on our end of the year report, and of course that PIMS. I think the biggest thing I would say that I've learned is just, like these wonderful updates that Kurt's sharing with you on all the activities. This is what we hear too on a quarterly basis. And then as a flex program director, I try to insert myself, jump in. I may not be the expert on this content, but I love to learn about it. I am a nurse by background, but even if you're not a nurse in background, as a flex program director, go attend one of those, the mental health first aid, because that really was geared for people that live in the community of that rural community. So not even necessarily happen to be a medical background, but how you experience that mental health episodes, at various parts of being in a rural community. So I would just say insert yourself and, participate in these different meetings, because there's a lot to learn. just, from a different perspective. So anyway, thanks, Kurt.
All right, so one more slide here. Just some of the challenges, that initial buy-in, as Mike referred to earlier, just, the Cism is there. And we actually have a state training grant fund that's about $600,000. We couldn't tap into that because the philosophy at the state level was that we have Cism. And as we all know, that's the reactor. I mean, that's how to treat us when we're reacting to an event. We want to be proactive. We want to think ahead and arm our personnel before they're responding to some of these horrific calls. So that initial buy-in was really tough, as well as just generally within EMS providers. North Dakota tough, or that rural challenge of kind of overcoming the stigmas. And outside of that, it's a lot of activities. Now with being able to meet and not be quite as COVID restricted, we are looking forward to the exciting things that we have to come.
Great, thank you so much for sharing about the work that you guys have been doing in North Dakota. There's a lot there. That's really cool, really good stuff. All right, John Noakes, can you talk to us for just a brief couple of minutes about the work that you are going to be doing in Washington?
Absolutely. I see our time frame here. So we're working on a sustainability project for rural EMS agencies, and we currently have 12 enrolled agencies in our state that represent all of our EMS regions. Back in June of 2021, if I can say that one right, one of our presentations was for mental health and wellness, which is one of the attributes that we're working on out of the 18 attributes of successful EMS services. We had a presenter from that's an in-state presenter that is his basically job, who is in the fire service. And again, as they've talked about throughout this, really speaks to people. You've done the job, you know the job, and we had a lot of impact from that. All of the people in our enrolled agencies, one of the things they wanted was more mental health awareness, more training. We looked at a couple ways to either do CISM, CISD type training, but it just wasn't practical to bring it all together in a group project setting. So we looked at what John and Mike are working on here and chatted with them about what we want to do. And basically our goal is to create kind of a train the trainer. So they're going to do a live session for us. It looks like we're going to be doing that in June. So I'm super excited about that. And our enrolled members are going to be the first people to do this. From there, they can go out and teach other people what they've learned, and they're going to put together a package for us that agencies can either deploy on their own or use these people that have been through the live course to continue bringing this to everyone in our state and even outside of our state if people are so interested. But really make it a peer-to-peer mental health with the background and the guidance and the knowledge from the materials they create. And that is a super brief background that gets us to 1 o'clock, right? Or 3 o'clock your time.
Yep, 3 o'clock our time. Thanks so much. We look forward to hearing how that goes in Washington as well. And I'm going to keep following along with North Dakota and Washington both, because I think this is really cool stuff. Patricia, would you go ahead and launch the exit polling? If everybody could just take a few minutes to answer these polling questions now that we have provided you this content, and let us know what kind of information you're kind of walking away from here. And while people do that, if there's any questions, anybody listening, participants, feel free to unmute your mics and ask your questions. I didn't see anything in the chat, but we could take a question really quick. Otherwise, we're about done here.
While we're kind of in that holding pattern, I'll just say I'm still a practicing paramedic. I've been in EMS for 25 years, and really that dynamic of having somebody from the outside come in versus being able to talk with somebody who's either had the same or similar experience as you is truly something impactful for our EMS community. I mean, you can have outside people, and not that they're bad people or good people, but the impact is different, even at that lower level, because most of our PTSD or our mental wellness happens on the way back from the call with our partners or our peers, or you find your old partner and you're sitting down talking around the table at the station, those kind of things. And being able to do a little bit more formalized with a little bit more training can be beneficial and impactful. And as we talked about rural providers, I mean, it's one thing when you work in an urban environment, you're working on patients. But in our rural environments, your patients are often your friends, your family, your peer, people you know, people you work with at the meet at the grocery store, all those things. And that really changes what mental wellness means for you, because you've got a whole different level of connection with who your patients are.
Yeah, absolutely. All right, hearing no questions, thank you to our speakers. Thank you to our participants for joining us. I can't say enough about how good this was. I just think this was great information. Thanks so much. So with that, we will go ahead and end this webinar. Thank you everybody for joining us.